I'm just going to hit record.
And so we are recording this today. So if you are okay with it, please turn on your video. And if you want to stay anonymous today during our call, that's all right too. So my name is Shauna Miker. I am an employer relations specialist with the Career Path program at ISS of BC. Today I'm joined by Steve Toth from Lempian. And we're going to kick it off here with alternative careers in pharmacy. I'm super excited about this opportunity to speak with Steve today. When he shared his presentation with me, I was like, wow, this is wonderful information. So I'm really hoping that everybody else finds some great value in this opportunity today. So saying that, we are going to go right into it. I'm going to have a couple of slides, then Steve will do a presentation. I'll do a few questions, and then we'll turn it over to everybody else in case they have questions as well today. Oops, can you stop sharing? Let me see. Let me try one more time. See if I pick the right screen. Yep. Okay. Can you see my screen?
Yep.
Awesome. Oh, it's interesting because everybody's disappeared. I just see myself now. This is new. So welcome everyone to Alternative Careers in Pharmacy. Before we get going, I would like to do a land acknowledgement. So we would like to start by acknowledging that the land on which we live is the traditional territory of the Coast Salish people, including the territories of the Musqueam, Squamish, Tsleil-Waututh, Kwantlen, Katzie, Coquitlam, and Kaikai nations. Also, we would like to acknowledge all other First Nation territories across Canada. And one of the things I like to do when I do a land acknowledgement, if I'm near a window, or if I'm not outside today, but if I was, have a little look at one of the trees and just really appreciate from where we are spending time together today in this land. So here's our agenda for today. I'm going to talk very briefly about the Career Path program, which is what I'm part of and who is hosting and facilitating this event today. We're going to do a presentation, and then I'm going to ask maybe one or two questions of Steve before we move into questions and answers from participants. So I hope that you guys bring lots of questions for the session. Maybe what we'll do is we'll just ask for people to either put questions in the chat, or if you do want to ask your questions verbally, which we totally encourage, that we hold those questions, at least the verbal ones, until the end. And then we'll do a little bit more career path info and a wrap up. So that is our agenda for today. So I'm not going to go into details, but I do want to just share some information about the Career Path program. It's called Career Path for Skilled Immigrants, and it is a program run by ISS of BC, among other service providers, but we're putting this on today. So we're going to talk about the ISS of BC Career Path program. You can see that there's a Career Path Scan Me code. If you would like more information, you can also take a photo of all those phone numbers. If you are not a Career Path program client, I would encourage you to reach out if you think you might be eligible, or to learn if you'll be eligible. I will share this screen again, or this slide at the end, just in case you don't capture it, but I did want to just touch base on it really quickly now in case anybody needed to leave early. So right to the main traction here. We're going to talk to Steve, Director of Lempian Health Communication. So Steve is a senior health communications executive with over 20 years of experience and passion for marketing communication. He has a solid understanding of the pharmaceutical, pharmacy, medical device, and cannabis sectors, and is a frequent proponent of integrating multidisciplinary cooperation into activities he is involved in. He is an advocate for thinking outside the box and believes in the power of creativity and innovation and the value they can bring to marketing. His drive for maximizing the impact of his work is coupled with persistence, and some of his friends think he never sleeps. So he is the director of Lempian, a Toronto-based boutique health communications and creative agency that he co-founded and built from the ground up. His experience with clients in North America, Europe, Asia, and provides valuable international insight and different perspectives to his work. From my perspective, Steve is involved in many things and has a wide breadth of interests. So I think it's better for him to share this information. Therefore, without much ado or more ado, welcome, Steve, and over to you. I'm going to stop sharing now.
Well, thanks very much for the introduction, and I hope I will be able to provide some useful information. And also, hello to everyone. Great to have you here. It's an honor and privilege to be sharing the next couple of slides and the information with you. Let me just put up a couple of slides from my end as well. Here we go. Before I jump into it, one additional thought. Pharmacy and pharmacists and the whole world around pharmacy is and has been a personal passion of mine, even though I do work in marketing. But over the past few years, I've just become really, really involved in a lot of projects that are closely related to pharmacy. So when I was asked by Shauna and the team at ISS of BC to deliver this presentation today, I was especially happy to do so because of that personal passion. A short disclaimer for administrative purposes. So throughout this presentation, you will hear me voice thoughts and opinions. And I just want to point out that those opinions are my personal opinions, not necessarily those of either my agency or of ISS of BC. And I also want to highlight that I did my due diligence in terms of compiling the information that I bring to you today. But hopefully there are not errors in there, but if there are, then just please keep in mind that you need to double check some of the information. So first off, let me just, I guess, continue that introduction that Shauna has started. So again, hello, everyone. A few words about what I do, and I want to talk about how all of these relate to what we're going to be talking about today. Shauna has mentioned, as far as my professional career, first and foremost, I'm the director of Lampion Health Communications, which is a health communications / marketing agency working in the health ecosystem overall, which obviously includes pharmacy and pharmacists, and very much so, and more about that a little bit later. Basically, our clients are primarily pharmaceutical companies, medical device companies, pharmacies, pharmacy banners, and we help these organizations communicate with each other in the marketing and promotional context, and to some extent in an educational context, creating educational materials, CME materials for these organizations. I'm also a member of the board of directors of the Ontario Pharmaceutical Marketing Association. So a word of explanation there. What has Ontario got to do with BC? I am currently in Toronto. I'm in the process of moving to Vancouver. But right now and up to this point, I have been living and working in Toronto and Ontario. Hence my work with the Ontario Pharmaceutical Marketing Association. Also an organization where I have the pleasure of working together with a lot of pharmacists. And I'll also talk about this a little bit more in a little bit. I'm a co-organizer of the Toronto Marketing Hub, which is a marketing, networking, and educational organization here in Toronto currently. But with my move to Vancouver, Vancouver Marketing Hub is coming soon. I'll also talk about how this also relates to your career paths and alternative career paths potentially. And two other things I'd like to mention. One is another agency that I am a co-founder of, which also works in the field of marketing. And more importantly, I'm a marketing advisor for an organization called International Pharmacists Anticoagulation Care Task Force, which is quite a mouthful, but is important because it was my segue into the world of pharmacy. Through my work with this organization, I had the opportunity to work together with and to get to know pharmacists from literally around the world, from Australia to Canada, from Brazil to Russia to Hong Kong, different parts of the world, and to see kind of that international perspective and to see where Canadian pharmacy is compared to all of those other countries. And that's also something that I will be talking about in just a little bit. But equally important to what I do professionally is who I am as a person. And the reason I think this is important, and these are a few of my personal passions and a few of the things that I like to do outside of work. Um, why do I bring this here? Why is this relevant or important? I think it's important because although we're here today to talk about alternative career paths for you as pharmacists, pharmacy professionals, who are not yet certified to work as pharmacists here in Canada and in BC, um, there is a professional side to that. But I think it's always important to keep in mind that there's a personal side to that. You have a professional passion, you're not able to work in that profession yet. That affects your personal lives, your livelihood, your state of mind. And I think when we talk about all of this today, it's very important to keep that human, personal side of things in mind. And that's why I wanted to share these little tidbits about myself, just to remind ourselves that first and foremost, we're people with passions and with goals in our lives. And during this presentation, what we're focusing on is the pharmacy profession and how that relates to that personal life and us trying to achieve our goals and just move forward in life. Um, You've seen a QR code on my slides, and you're going to see a couple of QR codes. I try to make it as easy as possible for you to access some of the information that you see here. At the end, there is going to be a QR code that will give you access to download this entire deck. So you don't need to take notes of things that you see on my slides, because you will be able to download the whole slide deck as a PDF with everything that you see in there. So just a heads up for that. This particular QR code leads to my LinkedIn profile. And the reason I put it on here is I want to encourage all of you to feel free to reach out to me, to connect with me on LinkedIn. I'm always happy to have a chat, to provide information, share my experiences, maybe help you connect with people who may be able to help you. Never hesitate to do that. And I try to make that easy by putting that QR code in here for you. And before we jump into some of the specifics of this career path and the alternative career paths, I wanted to share a success story with you. The story of someone who came to Canada as an immigrant quite a while ago, but still he was new in Canada, and to show you where he is today in pharmacy profession. And he started from exactly the same spot where you are today. So just keep this in mind. Basically, you can achieve anything you want to. You can be anyone you want to be in your profession, well, outside of the profession as well, of course. But let this be kind of a motivation and example to all of you. And the gentleman I want to talk to you a little bit about is Sharif. We've been working together on projects for about 6 years. And by chance, a couple of weeks ago, I found out that we're actually neighbors as well. He posted an image of his office, home office, looking out his window, and posted it on LinkedIn. And I was looking out my window, my home office, and thinking, well, it's the same view. And I messaged him and I asked him, well, Sharif, where do you live? It turns out he lives a couple of floors above me, but it's a huge building. We never met before. But as you see his path here, he started from, again, being exactly where you are right now, to opening his first store in 2002. He later on went on to become the president and chairman of the board of the Ontario College of Pharmacists, the equivalent of the BC College of Pharmacists, basically. So it's an important governing body of the pharmacy profession in the province. And you see the rest of the steps and stations here. Today, he's one of the co-owners of a group of pharmacies based primarily here in Ontario called On Farm United. It's two groups merged together. They have over 600 stores under their management. And in 2019, he was named Pharmacist of the Year in Canada. And currently, he's still in this position, but from 2022, he has been the president of the International Pharmaceutical Federation's pharmacy section. So basically, that's a global organization. That's as high as you can get pretty much in pharmacy, and that's where he ended up. Yes, it's been 20 years, but he's built that career. That path is entirely open to all of you. So just keep that in mind as you go through some of the struggles of getting certified here and whatnot. Like I said, you can be anything and anyone you want to be and achieve anything in your profession. You will also see a QR code here. Why is that here? This will take you to Sharif's LinkedIn profile. I spoke to him last night and told him that I was including him in this presentation. And I asked if he would be willing to connect with some of you if you reach out to him on LinkedIn to give you some advice or motivation or anything that he can help with. And he said he's more than happy to help. So feel free to connect with him. When you do connect, you're able to add a little note when you send the connection request, mention my name and refer to this presentation. He will know what you're referring to because I asked him and spoke to him. So again, it's an opportunity. I recommend to, he's just a great person to learn from and a very, very prominent pharmacist. A few words about the state of pharmacy to give you kind of the lay of the land when it comes to pharmacy in Canada and pharmacy in BC. This may not be new to some of you if you've done a bit of research, but I think it helps to understand how pharmacy may be different from whichever part of the world you practiced pharmacy before, and to give you an idea of some of the opportunities in this amazing profession. Essentially, just starting with an overview of some of the numbers in pharmacy. Pharmacy is very much an integral part of our healthcare system and more so day by day. And I'll go into more specifics about that. In some parts of the world, pharmacy is limited to dispensing drugs. Not to say that's not important, but in Canada, it's way more than that. Currently, there are approximately 42,500 pharmacists across Canada, and about 10,000 community pharmacies nationwide. So, of course, some of those pharmacists would be working in the hospital pharmacy setting and in other settings. Also, another note, in this presentation, I primarily refer to pharmacists, but a lot of this information is relevant to pharmacy professionals in general, so pharmacy techs as well, pharmacy technicians as well. Just for ease of putting the text on the slides, I refer to just pharmacists, but as I said, a lot of this applies to pharmacy technicians equally. So pharmacists' roles and responsibilities are very, very broad in Canada. And a lot of countries are really envious of what pharmacists can do in Canada. It comes, of course, it comes with responsibilities as well. But at the end of the day, pharmacists in Canada, to a large extent, are able to work and function almost like family doctors. There are now pharmacist-led health clinics where you walk in and it feels like walking into a physician-led clinic, but it's actually all pharmacists, which is amazing. It's a great way to take some of the load off certain parts of the healthcare system. Of course, it comes with extra loads and responsibilities, but also opportunities for you, the pharmacist. Pharmacists played an extremely important role in administering the COVID vaccine during the time of the pandemic. At the time, we participated in training all of the Shoppers Drug Mart pharmacists on how to do that. And the level of enthusiasm and openness and just drive to participate in helping with all of that was just awesome and amazing, and just contributed to my love of the whole profession. So, hats off to all of you pharmacists. Yes, there are some challenges today in pharmacy in Canada. Workforce shortages, which I guess is good news for you because once you're certified, that can make things a little bit easier. Whenever I talk to pharmacies and stores, they talk about shortages and that it's just more and more services that pharmacies are taking on, and they need more staff to do that, more qualified professionals. So there is, and there are places out there waiting for you once you have your certification. It can be challenging to balance business with the clinical responsibilities. There are business goals and key performance indicators that pharmacies have to meet, especially some of the large banner pharmacies. If you walk into a Shoppers Drug Mart, there are certain business goals that the pharmacy has to meet. But I think based on my experience overall, things are where they should be. It's just something to be mindful of. When you start working in pharmacy, you will sometimes feel that push and pull of like the business needs this, business needs you to be more efficient and spend a shorter amount of time with a patient, but you as a healthcare professional want to spend more time with a patient, and you kind of have to fight for it a little bit. But as I said, overall, I think things are well balanced, but that challenge is there sometimes. And of course, regulatory changes and just keeping up with what's new in the profession. I think that goes for any profession, but especially so in health, because it's an ever-changing industry and science, and it is important to be up to date. So it's just important to keep that in mind. There's definitely a trend that we're seeing where the scope of practice is becoming more and more broad. Now, pharmacists in Canada and most provinces are able to even prescribe medications. So not only dispense, but prescribe without having to consult a physician. And the range of medications and therapeutic areas where pharmacists are able to do that continues to expand. There's a very strong push from the government as well as from the pharmacy profession. So kind of everybody's pushing in the same direction. And pharmacists are very good at this. We participated in a market research project, and this was a couple of years back. So if anything, the results would be even more pronounced nowadays. But what we did during that study was we received data about 350,000 doses of vaccines that were administered by physicians and pharmacists across Canada. And what we as an agency were asked to do was to analyze that data and to see what happens with multi-dose vaccines. Some travel vaccines require 2 or 3 doses. So you get the first dose, you need to go back to your doctor or your pharmacist to get your second and third dose for that vaccine to be effective. And what we analyzed was how good are pharmacists at convincing patients and explaining to them why it's important for them to not only get the first dose, but to come back for the second and third dose. And how good are doctors at doing the same thing? It's what is called adherence and compliance, which I'm sure you're familiar with. It's very important when it comes to any medication that you take your medications as prescribed. Same goes for vaccines. And we found a significant difference in favor of pharmacists. What that means is we saw that pharmacists, whenever the first dose of vaccine was given by a pharmacist, patients were much more likely to return for their second and third dose than if they got their first dose at their family doctors. And that was due to a number of factors. More time to speak to a patient at a pharmacy than at a family doctor's, more convenient, easier to go to a pharmacy, but also just the dynamic of a pharmacy versus a doctor's office. You go to a doctor's office, we're all a little bit intimidated. Wow, what's the doctor going to think if we tell him we're not taking our medications? We better lie a little bit and tell them we are taking our medications. Whereas in the pharmacy environment, it's a service provider, right? You are all going to be service providers from the eyes of the general public. They're paying for some of your services, so that we're all a little bit more honest with our pharmacists. So long story short, we saw that pharmacists are actually better at doing a lot of the things that doctors have been doing for a long time. This is not to say doctors are bad at it. It just means that pharmacists are even better. So there's a huge opportunity for you to contribute and to do more for the healthcare system overall, for patients overall. There's also amazing, and I really recommend, just from the perspective of finding a job now and also later on when you are certified as a pharmacist, to look into advancements in personalized medicine. Pharmacogenomics, if you're not familiar with it, it's something that is up and coming. Basically, based on your genetic information, being able to provide a report to your patients saying, hey, if you have high blood pressure, this is the drug we recommend taking. This one you should not take because you're going to have an allergic reaction. That one you would need to take twice as much of, so go with this one. This is going to be the most effective. And there is a way now, based on genetics, to determine that. It costs, depends on the service provider, up to $500 one-time fee for the patient. And they have that report for a lifetime, and it's updated automatically. This is something that is done more and more in pharmacies. You no longer have to have guesswork in administering or recommending medications, and to just kind of find out by trial and error if someone has an allergic reaction to drugs. you can see based on this report. So areas like this, do a bit of research around this, because if you're able to show to a pharmacist, a store owner, that you know about these areas, you're going to be more attractive as a potential pharmacist working in that store. There's a service called Health Tab. It's not on here, like the word health and then tab, TAB. It's a company based out of Vancouver. Um, it's a device that allows you to give a drop of blood in the pharmacy environment, and it'll give you a range of metrics on your health without having to do a blood draw at a lab. And it takes 10 minutes. You can do it in a pharmacy. This device is being rolled out across pharmacies, and they're headquartered in Vancouver. So things like that, look into these things. It's just where pharmacy is headed in Canada, and it's an exciting place and direction. Just glancing at the time from now, I'm very passionate about pharmacy, and when I'm passionate about something, I tend to talk a lot about it. So I'll need to kind of moderate myself a little bit to make sure we get through everything. As far as British Columbia, zooming in, approximately 5,500 pharmacists licensed in BC currently. So out of 42,500 overall in Canada, 5,500 in BC. Out of 10,000 odd community pharmacies across Canada, 1,400, give or take, in the province. The roles of pharmacists and responsibilities are similar, so I'm not going to spend a lot of time on this, as what I talked about overall in terms of Canada. Pharmacists in BC do have the authority to prescribe for minor ailments and to renew prescriptions and to do more and more. So British Columbia is one of the provinces where that scope of practice is fairly broad. The challenges that I mentioned for Canada overall are there in BC as well. Some additional challenges: rural and remote areas, scattered smaller areas, providing access to pharmacy services. Again, future of pharmacy. There was recently a launch of a service where prescription drugs are delivered from pharmacies by drones to remote locations. The pilot was done here in Ontario, in Thunder Bay, but it's coming to different parts of Canada. It's coming to BC as well. So there are ways to address these challenges, but currently it's one of the challenges. And unfortunately, managing the impact of the opioid crisis, which again, I'm sure as pharmacists you're familiar with. If not, definitely look into it. It's something that affects most of North America. It's not just a Canadian or a BC issue, but BC is quite heavily affected by it. And just being there for these cases and knowing about naloxone, having those kits on hand in the pharmacy, being able to help if there is an overdose, and so on and so on. So it's something important to be aware of and look into. And opportunities similar to what I talked about in Canada, there is an opportunity there to collaborate more with healthcare professionals, with physicians. The good news is that there is more and more openness, whereas earlier there was more of a competition between physicians and pharmacists, generalizing, but that tended to be the case. Now there's more of a hand-in-hand collaboration. Again, this is generalizing, but that's the direction we're going in. So that's what you can expect once you are in that pharmacy environment. I've put up this chart, and this QR code will take you to that. It's a chart compiled by the Canadian Pharmacists Association, the CPHA. You see the provinces listed here. BC is the first column. And these are the different things that pharmacists are allowed to do in the pharmacy environment. The red cross means you're not allowed to do that. The blue check mark means yes, and the green means that it's undergoing discussion currently. You see that Alberta is at the forefront of this. It's all check marks. When we did that research with regards to the vaccinations and how successful different healthcare professionals were convincing patients to go back for their second and third dose, Alberta came out on top. Why? Because pharmacists in Alberta have had the most and the longest experience in talking to patients about prescriptions and vaccines and coming back for a second or third dose. And that clearly showed in the data. But our other provinces are up there as well. 2 years ago, this was a lot of red crosses. So really made great progress. And BC is actually a little bit further ahead currently than Ontario. If you look at, there's an extra cross here for Ontario, whereas BC, that's a check mark. So again, that QR code will take you to this table. It's updated annually. maybe even more frequently by the CPHA, it's just good to know this is what you as pharmacists can do in the pharmacy environment. This is what you'd be licensed to do once you become pharmacists. And last but not least, there are a number of surveys, and I'm referencing one here, but this particular survey was done by Ipsos. According to this survey, 78% of Canadians named pharmacists as the most trusted professionals, placing you, pharmacists, above doctors and pilots in terms of how much Canadians trust pharmacists. It's an opportunity, but it's also responsibility, right? You need to live up to that expectation. Hence the importance of learning and keeping yourself up to date and just being passionate about what you do, because this is what Canadians think about you, the pharmacist. And I hear this from practicing pharmacists, their eyes twinkling. And yes, this patient even came to my store to ask for my opinion about their next vacation destination. Imagine that. They're telling me, it's just an amazing relationship that you guys can build with your patients. So it may be a lot of blood and tears right now with the certification process, but a lot of smiles are coming down the road. So, just hang in there. The next section is a short disclaimer. I'm not an expert on the certification process, but I felt that I needed to look into this for you. So I compiled a bit of information and a trusted source for this information as well. But I'm pretty sure you're more or less aware of this process here. This essentially is what would take you from being a pharmacist new to Canada, not yet certified to work here, to actually become a pharmacist who's then certified to work here. It's a multi-step process. I'm not going to read out each individual step because I think they're pretty self-explanatory, but there is an organization called Pharmacists Gateway Canada. It's a federal organization, but speaks to provincial needs. The QR code will take you to a more detailed step-by-step of this whole process. They also include approximate costs. Overall, it's close to 20,000 Canadian dollars to get through this entire process. And the average, I'm told, is about a year and a half to get through this process. So that's the road, that's the journey that you need to get through. But, keep in mind all the fun stuff that you can get to once you're at the end of the journey. So let that be kind of motivation. And speak to professionals like Sharif to give you a bit of extra boost if you feel like, oh my God, I need to fill out another form, another this, another that. So, but I guess this just goes to show that pharmacy is a serious and important profession. So obviously the road to pharmacy has to have its filters to make sure that all the professionals who do end up working as pharmacists know their stuff and are able to provide the very best to patients. But definitely hang in there and good luck with this process. I think depending on when you started your life here in Canada, you will find, and I guess also depending on which part of the world you come from. I originally came here from Hungary, which tends to be a very bureaucratic country, unfortunately, where it's a bit of a fight with the authorities to get anything done. I personally found that in Canada, working through a process like this is kind of fun and games compared to what I was used to in Hungary. Again, it depends on where you come from, but I think you will find that overall, all the authorities and associations and agencies involved in this are there to support you and not to make life more difficult for you, even if it may seem like it at times, but they're actually very helpful. So yeah, also keep that in mind. So with that bit of an overview, honing in on I guess the actual topic of today, alternative career paths. So what does this mean, and what is this about? These alternative career paths that I've compiled, and these are not the only ones. I just compiled some of the ones that came to mind and that I've encountered. They're all alternatives that will still let you leverage your knowledge and your passion as a pharmacist without already being a certified pharmacist. That being said, I have a lot of friends in the industry who are certified to work as pharmacists, and yet they have pursued these alternative career paths because they provide some other ways of making a difference and helping patients. And some of them flip-flop back and forth between the pharmacy environment and then these alternative paths. So, the choice is alternatively yours, but these are all great ways for you to start to grow roots here professionally and to not have to go down alternative routes where you're not leveraging your knowledge of pharmacy at all. So that's kind of the lens that I put on when I compiled this, and when we had the chat with Shauna and her team at the Amazing ISIS of BC. So the first area I want to start with is what is closest to home. And I mentioned at the beginning when I was talking about all the things that I'm involved in, that wasn't for me to like show off professionally about all the things that I do. It's because it was just to show you my connection to the world of marketing. That's where I'm drawing this information from. And this is where these recommendations come from, my involvement with all of those organizations and having met professionals through those organizations. Now, for each broad area that I'm going to talk about, you will see some specific roles named. It doesn't mean that these are the only roles. This is just to give you some ideas of areas to poke around in. So let's go through these. Medical writer. I'm sure you're able to guess what that is, or you know what that is, but just in a nutshell, a medical writer is someone who would write medical content, typically for a marketing agency or a communications agency, such as my agency, Lampion. Sometimes you would have medical writers working for pharmaceutical companies because sometimes they have internal teams who produce their promotional materials and they need someone to write the copy, the text related to those. And as pharmacists, you have a knowledge of healthcare, you have a knowledge of different therapeutic areas, you know the lingo, you know how healthcare systems work in general. Doesn't matter which part of the world you've been practicing as a pharmacist before, or even if you haven't and you're just fresh graduates, you have knowledge that is of value to marketing agencies, pharmaceutical companies from a marketing and communications perspective. What you would need and when you would like this sort of role is if you like and are good at writing text, understanding medical terminology, have some research skills, and are able to essentially be told, hey, we need a paragraph of text about so and so topic. And then you go and write that text and bring it back and deliver that text. You could also work as a freelancer. We as an agency work together with a lot of pharmacy professionals who are freelancers and who we contact, we agree on an hourly rate or on a fixed rate, and the pharmacist would write text and deliver it to us. So it can be very flexible. It can take you to multiple parts of the industry. It can also help you meet people for later on when you are certified as a pharmacist. So it can have multiple benefits. Something else you can do as a medical writer is to help write educational content. CMEs, continuing medical education courses as well. So it's something that's worth thinking about. Medical marketing specialist, it's similar but different. Basically helping to create marketing materials that convey medical information and importantly, that resonate with healthcare professionals. Obviously, it's going to be easiest and the best fit if that marketing material that a pharmaceutical company is producing or that a marketing agency is producing for a pharmaceutical company. It's going to be easiest for you if the target audience is pharmacists because you yourself come from that world or are headed to that world. So then you're able to write content and propose content that speaks to you as a pharmacy professional. But being a healthcare professional, you're going to be able to have a pretty good idea of what would resonate with a doctor, with a nurse, with other healthcare professionals. It's just a mindset thing. And I know, again, we as an agency work together with multiple pharmacy professionals. And for example, when we're working on a marketing campaign and we're working on new creative ideas, we would run those ideas by pharmacists and say, hey, do you think this is a good idea? Would you think this is fun? And would you click on this ad, for example, or would you think this is garbage and just be annoyed by it or even offended by it? So that's something you can absolutely do. And what we as an agency and what other agencies would look at is not your pharmacy certification, but your range of skills, as with any job interview or conversation, but the fact that you are a pharmacist and you have that background and knowledge. So I think this is a great opportunity and it's very flexible. And I'm happy to tell you more about this as this is closest to home if you reach out to me. Um, some roles in the pharmaceutical industry. Something to keep in mind is because of that broad scope of Canadian pharmacy, pharmacists have a huge say in which drugs patients take. So pharmaceutical companies basically, to put it in a raw, not to be rude way, they want to be friends with you as pharmacists. They want pharmacists to prescribe their drug in a fair and balanced way. There is heavy regulation to make sure that the messaging is fair and balanced, but they want pharmacists to know about their drugs and to have if possible, and if clinically justified, have a preference for their drugs. So you as a pharmacy professional uh, are an interesting person for a pharmaceutical company. You could be an effective salesperson working on their behalf, going into pharmacies and talking to pharmacists because you speak the same language, you have the same background. Again, doesn't matter if you're not certified yet. All they care about is do you have the knowledge and the mindset. Um, the skills required, you see them on the screen. Obviously, you need to be able to communicate. You need to like that sort of salesy world. It's not for everyone, but it can actually be fun. And again, it is related to pharmacy. Another possible area is within the pharmaceutical industry is regulatory affairs. Um, Basically, pharmaceutical products and any changes to the product monographs, for example, have to go through rigorous regulatory scrutiny. And pharmaceutical companies need professionals who help them make sure that they are compliant. And a lot of the time, those professionals are pharmacists. There are also a lot of physicians working in those positions, but a lot of pharmacy professionals as well. Slightly different skill set, attention to detail. Obviously, you need to do your homework and know the regulatory guidelines, um, and have documentation skills. It just comes from the role, but it certainly is, I think, a good opportunity as well. Um, and it will also, again, give you more insight into the industry and give you knowledge that's going to be useful later on if you do then go and work in the pharmacy environment as a pharmacist. Research and development roles. So clinical research coordinator, for example, working in these roles. Again, it's about you having the mindset, speaking the lingo, um, knowing about adverse reactions and adverse events that may be triggered by certain drugs, things to look out for, just having that mindset and the skills um, gives you that ability and opportunity to be involved in medical research projects. These can be specialized research organizations who do research and development on behalf of pharmaceutical companies or larger pharmaceutical companies. They have their own R&D departments. I guess the challenge here is that Canada being a smaller market in terms of population, a lot of global pharmaceutical companies would do that R&D in wherever their head offices are. So perhaps a little bit more difficult to get into this area, but there is still potential there. Medical science liaison, and that's actually also an opportunity in the pharmaceutical space where you can be the voice of healthcare professionals when talking about certain drugs. You can be the voice of healthcare professionals internally when talking to different business units in their meetings with the marketing team in a pharmaceutical company and revenue teams, and they need the healthcare professional perspective, sometimes specifically the pharmacist perspective. And you can be that liaison between the healthcare professional world and the marketing world and revenue world within pharmaceutical companies. So that's what this um, role is about and this opportunity is about. Some other roles here, healthcare administration roles, maybe a little bit more on the dry side, perhaps, but still opportunities nonetheless. Nonetheless, healthcare policy analyst, it sounds very scientific, I guess. But again, being a part of provincial processes, working for or with the college or various government organizations to help review, analyze policies, to help develop new policies. Um, a policy analyst might be asked to look at certain parts of the healthcare system, and in your case, specifically related to pharmacy, For example, we broadened the scope of pharmacy with minor ailments prescribing. How does that work? Do the processes work well? Is there adequate oversight? Then you, as someone understanding the world of pharmacy, can come in and look at those processes and basically share your 2 cents and say, well, yeah, I think these policies are not adequate. We should change this process here. And they work together with you, and you're pretty much a subject matter expert or consultant in this kind of role. Um, Health information manager is, again, a bit of a just dry role, but managing patient records, ensuring data accuracy. This kind of role could exist in the pharmacy environment. In larger stores, they need additional staff, which is a great way to get into the pharmacy environment. Sometimes this is done by pharmacy technicians, sometimes by the pharmacist on duty, but there's certainly these, I'd say, more administrative opportunities out there as well that you're able to tap into if this is something that that speaks to you, obviously. I've also compiled a few resources, and again, you'll be able to download the deck. And there are QR codes in here, so when you have the deck, it'll be easier to just go to these websites and not have to type a whole lot. I did not make them clickable. I should have done that to make it even easier. But anyway, scan the QR codes and you'll get to the sites, or just Google the resources and the organizations. But a few words about these. Canadian Pharmacists Association, CPHA, it's a federal organization. They have a large say in driving policies in politics as well, related to pharmacy overall, and then at provincial levels as well. They're definitely, and that diagram with the check boxes and the check marks and the X's, that's from the CPHA website. They do have some great educational initiatives as well. It's worth tapping into those as well to bring yourself up to date on what is going on in Canadian pharmacy. So I would say it's definitely a good resource. Also worth reaching out to them and poke around on their website, poke around on LinkedIn, see who works at the CPHA, and try to talk to them. And again, majority of people you will find are very helpful and open to help. British Columbia Pharmacy Association, so basically the same as CPHA, but at the provincial level, driving policies at the provincial level, able to give lots of great advice with regards to your certification within BC, and again, educational resources as well, and some events as well that are worth tapping into. Pharmacy Examining Board of Canada, it's one of the stepping stones of the process to get certified. You saw it in the steps description there. So you will have to interact with them, but you can look at their website, see some of their requirements, policies, and learn a little bit more about them. I'm pretty sure you've already seen them if you're actively working on being certified. College of Pharmacists of British Columbia, CPBC, again, a very important organization in terms of I would say day-to-day oversight of the pharmacy profession and pharmacy practice in BC. So they're going to be an organization you interact with down the road as well when you are already working as a pharmacist. So definitely useful to look at. BC Health Careers, it's not just pharmacy, but other opportunities there as well, worth looking at. Some of the alternative career path options as well, and also once you're looking at pharmacy positions. International Pharmacy Graduates Program is a UBC site and program and initiative. Basically, if you graduated in another country as a pharmacist, they provide various resources and guidance on this website and through the program. And last, but hopefully not least, two resources that Lampion is actively involved in. The first one is a podcast series. It's called The Pharmacists Are In. It is hosted by two, I would say, pharmacy key opinion leaders. John Papasturgiou, he is based in Toronto, and Ajit Johal, he's based in Vancouver. Both of them great guys. Um, Ajit does a lot of work in the vaccination space as a pharmacist. He's on media quite a lot. John also is on TV quite a lot, talking about various pharmacy-related issues and opportunities. But what this podcast series is, and I recommend not because it's a kind of a love project of Lampions, but it's not the reason I'm recommending it. I just genuinely think it's useful. It's the earlier episodes are hosted by John, and there's always a guest, a subject matter expert guest. They have a conversation, an informal conversation about a specific therapeutic area and how that relates to pharmacy, how pharmacists can help with vaccinations, for example, with vaccine hesitancy, with a lot of issues. It's very, very practical. Our aim is to provide down-to-earth, practical experiences from the pharmacy space. And then the most recent episodes, and a new one is coming out. I think we're publishing it tomorrow. It's Ajit and John, the two pharmacists, having a back and forth and a conversation around specific topics that pharmacists have to deal with in the pharmacy environment. And these are unedited conversations. So it's genuinely two very experienced Canadian pharmacists bouncing ideas and thoughts around about things they experience in their day-to-day practice as a pharmacist. So it's a really good, it's like a pulse of pharmacy type thing if you tap into it. Our kind of tagline for it is a podcast made by pharmacists for pharmacists. And that's what it really is. And lastly, the pharmacy zone. There are only two things that you will find there now, but just basically on the one hand, the episodes of the pharmacists are in. That podcast is also available on Spotify, iTunes, Google Podcasts, which is transitioning to YouTube Music and YouTube Podcasts. So you can listen to it there as well. It doesn't have to be through the Pharmacy Zone. The Pharmacy Zone is a platform that we've created and that we're growing specifically for pharmacists. Right now, it's just a podcast and some pharmacy profession related fun merchandise and crazy stuff, t-shirts and little odd bits and pieces that are specifically for pharmacists and memes from primarily the Canadian pharmacy world. But very shortly, we're going to be publishing pharmacy-related news and information on this site. That's why it's worth keeping an eye on that. Of course, there are a ton of other resources as well. Just a couple of resources that I thought would be relevant to you and to your path, basically. So with that, we come to the end of this presentation. Two more QR codes. I guess my slide deck is a collection of QR codes. One is, again, my LinkedIn QR code if you want to connect with me. And this other one is your QR code to download the PDF version of this deck. If you have any issues for whatever reason with the download, it's on a SharePoint folder. You should be able to access it. Then use the other QR code and message me and I will send it to you. Yeah. So with that, I'll stop here and look forward to hearing some of your questions, and fingers crossed that I'll be able to answer those questions. But I hope you found this little whirlwind tour useful.
Thank you, Steve. That was amazing. Like, my mind is blown, and I had looked at the deck earlier, but hearing you speak it and talk through it, there's just such a wealth of information that you've shared today. So I'm really thrilled that we were able to connect and for you to share. Saying that, I have a couple of questions that to get us off, kick us off here on the topics that you've covered. So my first question is, you've mentioned a number of potential alternative careers, and I think I created a list of them, and I think there was 12, right? And so one of the things that I want to kind of ask you with or about is, people that are in pharmacy and have worked in pharmacy in their home country, they obviously went to post-secondary education, they got certified in their home country. They may be going through that process now, but you've now kind of opened the door and given them these other ideas of where they could pursue their career in the short or the long term. So saying that, number one, my first question is, do you think that some of these professions, because there might be more things that happen back east in Toronto, do some of these professions occur here in BC? I guess that's my first question. And then what suggestions would you have for people to do research to learn more about these professions? Because again, if someone had tunnel vision, I'm going to pharmacy, and going to become a pharmacist, this whole research thing for new careers may be a bit new to them.
Yeah, thanks very much for those questions. So first and foremost, when putting this deck together, there were some references to Toronto and Ontario just because I've lived my life here for the past odd few years. But I had my Vancouver hat on, and I'm in the process of transitioning there and living there. So all the information I included here is relevant to Vancouver. That being said, so short answer is, are these positions available and viable in BC? Yes, they are. Longer answer, some of them may be harder to find than perhaps in Ontario. The pharmaceutical company ones might be harder to find because a lot of pharmaceutical companies have their headquarters either in Montreal or in Toronto, but some of them have their headquarters in Vancouver. And what I might also add is, don't just think pharmaceutical company. That was my mistake saying it that way. Medical device companies as well. Um, we're working with a client in BC right now, and they're an amazing company. They produce what are called continuous glucose monitors that help people living with diabetes. They're based in Vancouver. Their Canadian headquarters is in Vancouver, and there are a number of companies there as well. Health Tab that I mentioned um, is based in Vancouver, uh, and there are opportunities there as well.
Oh,
So
great.
definitely. And the second question, where would you find out more about these roles? Where would you find these roles? So where you would find these roles is, well, pretty much where you would find any other job opportunities. I listed one specific site in the resources, but just keeping an eye out for these kinds of roles that were listed on all the regular channels that you normally search for. But to learn more about them, what I would recommend is try to connect with people who work in these roles. One trick that maybe works well is, even without a subscription or a premium subscription on LinkedIn, you can search for people who have a PharmD or pharmacy background and look at those people and where they work. You're bound to see them working at marketing agencies, pharmaceutical companies. Some of them will be working in pharmacy environment, and try to connect with them. Just be open and say, hey, this is who I am. I would love to have a chat with you. Do you have 15 minutes? Do you have 30 minutes? Um, Also, if you connect with me on LinkedIn and you see that that person is connected to me, then I'm happy to make an introduction and to help you make that connection. And then you can just talk to them and ask them about what they do, how it works. Maybe they can even refer you to a position. So also going to events, um, that I'm not uh, familiar with quite yet in terms of the types of events that happen in Vancouver that are related to, or BC in general. Don't just want to limit this to Vancouver, that are related to pharmacy and pharmaceuticals, but network, 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 talk to people. Don't be afraid to ask for help. And remember, odds are that the person you're talking to was in the same shoes that you are in right now, except it's just a question of how many years ago, right? So always keep that in mind and don't be shy about it.
Great. Well, thank you. I think you've answered my questions. So you're a big proponent of and suggesting informational interviews or coffee chats. That's just another way to say what you're saying. So one of the things I'm just going to call out, that if clients on this call are not familiar with informational interviews or coffee chats, as they may sometimes be referred to, please reach out to your career strategist or your ERS to have more of a conversation. Google that term. Um, I too am a huge proponent of that and networking. So just a funny little story before we open the situation to questions. Steve and I actually met very randomly through a networking event. And when he talks about don't be afraid to ask for help, when I learned what he did professionally, I'm like, maybe he has knowledge that could help our clients. So I asked and he answered the call. So people are very generous often with their time. And, I kind of have the rule of thumb, ask once, twice, or three times of someone you don't know if you're knocking on the door through LinkedIn. And then if not, find somebody else that's the connector. It's what you want to find, the connectors in your career path sort of thing. So On that note, let's move it on
Sorry, may I
to,
add?
oh, go ahead.
I'm
Yeah,
sorry to interrupt. May I add one thing to that, one thought?
sure.
I
Yep.
what my experience is when reaching out to people to ask them for help or advice. Um, one thing that I learned when I moved to Canada from Hungary is that Canada, and I guess North America in general, often tends to be a little bit less formal than some other countries. So when you reach out to someone, just be yourself and be a person. No need to make it very formal and like basically almost put in a formal letter of request for help. Say, hey, I hope you're having an amazing day. My name is so and so. I would love to have a chat with you. I love your experience. Would you have a few minutes for me? Something that's what I would recommend. But I hope I don't know if Shauna would agree, but like keep it person to person. Don't make it too formal. They're more likely to help, I think, and it's just going to be a more fruitful conversation, I think. Yeah.
I totally agree. And, I've known people to literally un unexpectedly even network by picking up their kids from a play date. I know a fellow who he's worked for Microsoft for years and ended up meeting the parent of the other child and having this very casual conversation that was unexpected. And, 10 years later, he's still at Microsoft. So I would just tell people to really open their eyes to opportunities, and every kind of social engagement is also now a networking opportunity. So saying that, we're going to go into our questions. Some of these may already be answered. So Steve, if you feel like you've kind of already answered them, we'll pass them by, but I will ask them just to make sure. So the first question is from Ivana. So thanks, Ivana, for being the first person. That's awesome. Sometimes it's hard to be the first. So what are the basic requirements to become a medical marketing specialist? And what are the most promising and innovative directions or trends expected to shape the future of pharmacy industry?
Wow, very good questions and two very different questions. So, what are the requirements? Um, I would say there are no standardized requirements to become a medical marketing professional. It really depends on the type of position. So on the one hand, is it a marketing agency? Is it on the agency side, as we say, or is it on the industry side, meaning the pharmaceutical company or medical device company? If it's on the agency side, um, it's communication skills. Again, being genuine, I think, is always important in any scenario. Um, but being able to demonstrate that you can bring something to the table that other folks working at the marketing agency don't have. They might have a creative who can come up with crazy marketing ideas, but he doesn't know the next thing about high blood pressure and drugs related to bringing that blood pressure down. That's where you come in. So just being able to demonstrate that knowledge and that passion. Um, in my experience, and also at our agency, there's no, we're not going to scrutinize your credentials. We would take a look at them, but what we're interested in is having a conversation and seeing if you bring that additional knowledge to the table. Now, if you're talking to a pharmaceutical company or a medical device company, then usually it's a more specific therapeutic area that they're interested in. So obviously, doing a bit of research in terms of that therapeutic area to be able to demonstrate your knowledge of that particular therapeutic area. Because what you need to keep in mind is pharmaceutical companies that have multiple brands and drugs and work across multiple therapeutic areas. It's almost like each brand is its own company within the company. So Bayer Pharmaceuticals, for example, their aspirin team is very different from their Kylena team, which is within the women's health department. Like it's different worlds. So you just need to be familiar with that therapeutic area. Um, in terms of some of the innovations that are coming to the world of pharmacy, I did speak to these a little bit. I spoke about pharmacogenomics. I definitely recommend. It's just such a fun and exciting, and actually not just pharmacists. I talked about this to my friends as well, to have that. Some people are a bit weary of having genetic information stored, but I think the benefits outweigh the risks. It's just great to know what kind of drug you can take less of, and it's still going to be effective. Because otherwise, it's a one size fits all dosing, and this is about personalized dosing. So, personalized dosing, personalized medicine is definitely a big one. Health tab and just in general clinical services related to pharmacy are another big one. If you look at that table that I showed you with the check marks, look at the individual rows and familiarize yourself with those activities or services. Would you be able and willing to administer a vaccine? Do you know enough about vaccines? What vaccines can Canadian pharmacists administer? And that range is just getting broader and broader. So that's definitely another trend that is happening. Um, and Overall, pharmacists working and dipping their toes into areas such as mental health, which is super challenging if you think about the busy pharmacy environment. But that's more and more um, visible in pharmacy as well. That's coming to pharmacy as well. Um, so, and so listening to episodes of The Pharmacists Are In will give you some clues as to what's coming to pharmacy. Both of those pharmacists they do crazy things. One of the hosts, John Papastergiou, he had the Minister of Health from Norway come to Canada, not on a state visit, but to go to his pharmacy store and learn about some of the processes that he applies, which is crazy if you think about it. Like that's how, you know, innovative Canadian pharmacy can be. So just keep an eye on all of those things. And also on some of the other resources that I mentioned will give you additional clues.
Okay. Next one was not a question, just a comment, but thank you for the presentation. It was a great opportunity for me. Thank you very much for it. It was a great presentation. Again, thank you. It's very helpful. All right, moving on to the next question. For a pharmacy assistant, can having an online course such as medical terminology and Kroll's software be enough or useful?
Well, answering the second part, can it be useful? Absolutely, it can be useful. Whether it can be enough or not, I don't know if that is the answer to that because I'm not familiar with that part of the certification. But I would say asking the BC College of Pharmacy is probably a good idea to ask them specifically. I would lean towards yes, but the honest answer is I don't know. I'm just gut feeling says yes, it would be sufficient.
Okay, so it sounds like Parisa needs to do some more research on that one. Okay, but that's great. And then just thank you for your time and great presentation. So I just want to, because that's the last question we have. Do we have any questions that people want to actually unmute themselves and ask from the floor? And we do have about 16 people on this call right now. Oh, this is your opportunity. Oh, I hear somebody. Oh, great.
Hello, my
Ivana,
name is Ivana. Yeah.
perfect. Thank you.
I just want to share like my honest feedback, and I really thank you for this presentation because before visiting it, I really had some hesitations. I was thinking maybe this will be like presentation about successful success, but I was surprised. This presentation was full of important details and useful resources, and it was really helpful. Good job. Thank you.
Well, thank you so much. I'm really glad you feel that way. And if there's other information you need, and if I'm able to answer, remember, feel free to reach out to me afterwards as well.
Yeah, I will do. Thank you.
Very motivating is what I'm getting from that. Anybody else who would like to ask a question? Yes, Parina, go ahead.
Hi, thank you so much for the presentation. It was like a light in the darkness. Yeah, yeah. Before this, I was feeling like under pressure because I'm doing my credentials. Now, after learning what else can I do as a pharmacist, I feel very good. Thank you so much.
You're very welcome, and that's great to hear. Yeah, it is an amazing profession, and as you saw, Canadians really respect you as pharmacists. So I think that's just good to know that, and just keep that in mind. Yeah.
I love that. I'm going to use that as a quote, light in the darkness. This presentation and this event has been light in the darkness.
But I
Any
appreciate that. That's really kind of you. Thank you.
Any other questions that people want to ask verbally on the phone or via the chat? I think we also have some staff members on. Is there anybody from the staff that has questions? Well, I'm going to ask Steve a question since nobody else is jumping in. Steve, on one of your slides, you had you referenced the College of Pharmacists, right? Pharmacists of BC. And so what I was wondering, and you may not know the answer, but I'm going to ask it anyway, is that I know some of the medical type kind of colleges, like College of Psychologists in British Columbia, are amalgamating here pretty quickly if they haven't already amalgamated, and that's being driven by the BC provincial government. Do you know, is the College of Pharmacists remaining as it's a standalone college by itself, or is it getting amalgamated with any other healthcare service providers?
Again, two answers to this. The short answer is I don't know, but just again, based on my experience in the industry and thinking of similar processes that I've seen in other provinces, I think pharmacy, although works closely together with some of the other branches of healthcare, it is very distinct in many other ways. So I would assume that it's going to stay as it is because it's very different from some of the other areas that are perhaps easier to amalgamate. But again, that's just my experience and gut feeling. It's not factual knowledge of whether that's happening or not.
Okay. Any other questions from the audience and the participants? So what I'm going to do then is I'm going to ask a question of myself to the audience. And I would love to hear in the chat, or if you want to share it, what is your top learning or takeaway or an aha moment that you had today from this presentation? What did you not know yesterday that you now know today, or what inspired you from this presentation? So I'd love for people to put in the chat if they'd like to share.
I'll just speak up, Shauna. I think that I just started working with a pharmacist, so it's kind of a whole new area for me. And I have to say, Steve, I'm going to echo what was already said. It's like a light bulb turned on, especially the alternative careers. I think, it really shows how you can use these skills to kind of go down different career paths. It doesn't just mean standing behind a counter in a pharmacy. So I think that really showing this to the people who are on the call tonight has been excellent. I know it's been excellent for me as well. I took lots of screenshots of all the QR codes because I will be checking those out tomorrow. So thank you again.
Well, you're welcome, and that's awesome. I think, with all of those roles, one key thing to remember and also to tell any other clients of ISSOBC as well who are looking to pursue a career as a pharmacist is a lot of people in the health ecosystem want to be on good terms with or friends with pharmacists because pharmacists are making such a big difference and they have such a big say in the way healthcare and like the treatment of specific patients goes. Because of that broad scope of pharmacy, pharmacists are influencing patient decisions, and that's important to a lot of companies. So that's something that is good to know, and pharmacists are able to leverage when looking for alternative career options. You have a background and knowledge that is of value to a lot of organizations in the health ecosystem.
Well, there's a comment in the chat from Lynn, and she said, "Thank you, Steve, for the presentation. There are a lot more alternative careers than I knew. Great knowledge." One of the things I think that I'm kind of reflecting on in this call is in the years that I've been doing this job, and we have pharmacists in our program. And I personally have not provided service to a client that's a pharmacist, but I think from the outside in, I kind of really always thought that there's like, you're going down this journey and, you got to get to the finish line and you have to get credentialed. And so you can work as a pharmacist. And I just think that we as service providers with many different clients in many different professions, we are always looking for these alternative options, either as a first step or maybe as a long term, right? Depending on people's choices. So I think it's really interesting, this conversation we've had today, because it's just really been mind-blowing, I think. And I hope this is the beginning of conversations on this topic in my team and with our clients. And it's not just a one-time thing. I think it will open the door on those sorts of conversations. So, and we have recorded it today, so we will share it with future clients and maybe future staff. Like, I kind of think that this should be like one of our training videos. If you're going to have a pharmacist client, watch Steve's video first before you engage with anybody. So we've got another comment, and it's just from Ivana. So thank you, Ivana. It was great to hear about medical marketing specialist positions and get a lot of new resources and podcasts that we can use. So yeah, I when Steve and I were first talking, I remember him mentioning these couple of podcasts, and I'm like, wow, like, again, not just that he's coming to talk to us, but he's giving us more resources. So and it's a resource that people can continue to use long after we finish this presentation today. So, and it sounds like there's obviously ongoing episodes. So people that are working or working towards their credentials, you know, to really understand the industry, I think it's a really couple of great resources that people can leverage. So, well, saying that, I'm going to
Hold
take
on,
last.
Sean, I got my hand up. I got one more thing to say, because the other
Okay.
thing, I'm sorry, the
Okay.
other thing I really appreciated, Steve, was your plug for networking. It's a horse that we like to beat dead at Career Paths, because I can't stress how important it is. But I really appreciated your comment about, even if you don't have LinkedIn Premium, like just searching for profiles, looking at people's work histories, seeing how they've been able to form their path, researching those companies, being personal when you reach out to people instead of being really formal or a bit robotic, and really tailoring those messages to the individual person, and that putting yourself out there, using, like you said, Shauna, using every opportunity. Like, who knows, at the bus stop, in the grocery store, who knows where you're going to find a person who's going to have the information for you. So just don't be afraid to talk.
Yes. I often am asking clients to get away from the back of their computer or the front of their computer. And it can feel scary to people at first, right? And especially I would think from people that, again, had they thought this very linear career path, right? And so if they're wanting to take on one of these kind of other alternative careers, it is going to take some research, and it's going to take talking to people. But people in general are really kind, and I know that I've had many people that I've reached out to over the years, and you think you might be showing up for 15 minutes and they give you a half an hour or even an hour. It's not always expected, but you know, it's amazing what you can learn from other people. So, and that Steve's opened up his network himself, and is it Sharif, the pharmacist of the year, and to share his career path. I think that was also amazing, and that, you know, he's not even here today, and he's opening the door to connecting with people. The one thing I'm going to just say, I know that there was a QR code, and Steve and you've talked about, I think you and I talked about this, or it's somebody else that we networked with. I think there is a way when you use the QR code to send a message, because that's the one thing, when you use a QR code, it basically kind of tries to just make that connection. And one of the things, this is more in general, when you're trying to reach out to people, I suggest that you do reach out to them via the computer, because it seems to be easier to be able to send a note when you go to connect with someone. Don't just press connect. The one thing is, if you use your phone and you press connect, it typically, from what I've seen so far, although I've heard that there is a way to do it, to send a note, but in general, it just sends the connection. And once you sent the connection, you can't always send a note. So my
If
tip
we
of the
have
day.
one moment, I might be able to, if in case this is useful, I might be able to show you how, if you come across that, because it might be useful for networking
Absolutely.
in general. Just bear with me for 1 second. So what I'm hoping to do, but I don't know if I'll be able to do it. I might not be able to do it now. I wanted to quickly just share. Just give me 1 second here. Okay, I won't be able to. I wanted to share my phone screen and share that here, but it's not connecting for some reason, Murphy's Law. But basically, on the phone in LinkedIn, when you see a person's profile, there is either a connect button or a follow button. But there's also 3 dots on the side, and this is on the phone. And if you click the 3 dots, a menu opens up, and it says connect with a note or personalized connection or something along those lines. If you select that one, it will allow you to add that note, and that is, to Shauna's point, that is really important. The QR codes that I included here will not initiate the connection. It will just bring up the profile on your phone if you scan it. And then you can go into the 3 dots and like personalize invite or whatever it's called. That's what I wanted to share here on the screen. Yeah, I hope that helps.
No, absolutely, right? That fantastic. I've learned something even new today that about networking, and anybody who works with me or knows me knows that I'm a huge proponent and supporter of networking. So I will share this new tip with other people again. So saying that, I'm going to just do final call. We've got another thank you in the chat. Saying that if we have any final questions, I am going to put my slide deck back up and just do a quick wrap up here today.
Can you please share the QR codes again?
You know what, Steve, is it okay for us to send out your presentation so that people can just get it from an email as well? Or do you want
It
to go back to?
absolutely is. I can share it on screen here
Okay.
for a sec. So the QR
Perfect.
code on the right would be the one that leads you to this deck, but I'll send you the PDF as well, and you are happy, or you're welcome to share it in an email as well.
Perfect. Awesome. Thank you. So we'll just leave that up for a second and then I'll share my screen and we'll finish up. Anybody still need it, or are we done?
Let me know when I can stop.
Let's give it 1, 2, 3. All right. If you can stop sharing, Steve, then we can move on to the rest of my presentation and we'll go from there.
And I can't see the stop sharing button. So if you can stop, there we go. Cool. Thank you.
I know, isn't that funny?
Yeah.
All right. So this is the slide that I showed earlier today. So in addition to the Career Paths program, I just want to also talk a little bit about another program that we have. Steve mentioned, and I wrote down that it takes, about $20,000 and about 1 year on average for people to get certified in pharmacy. So it's definitely a time commitment, but even more so, it's a financial commitment. Career Paths clients, if you're someone who is already in the Career Paths program, you're getting support through us, and you know that there is some funding to support that journey, but obviously not anywhere near $20,000. So we do have another program I want to just mention today, and it's called Global Talent Loans. And so if you are a Career Paths client, please reach out to your career strategist because they can talk more about the Global Talent Loan and the opportunities for a low interest loan. If you are not a Global Talent, or if you're not a Career Paths client and you think that this is of interest and that you're a pharmacist or a different profession, please use the Scan Me or take a screenshot or a photo of the slide today so that you can reach out and do an intake and see if you are eligible for our program. So I would always start with Career Paths because, oops, I want to go back. I'm obviously going to share information about our program, but I think the other one is very complimentary. And if this was a presentation being put on by Global Talent Loans, they'd probably be talking about their program first. So that kind of concludes with regards to the 2 programs that I want to talk about today. But I have one more slide. And it's just to thank you for coming. So I want to wrap up and thank Steve for sharing his knowledge with us today. I hope you've all found his presentation and his answers insightful. I know I really did. Also, thank you for joining us today to learn about alternative careers in pharmacy. And I'm really glad there was a comment that somebody was kind of thinking it was just going to be a presentation about successes, and where this is really I think a presentation about opening doors. So I know I asked, I didn't really get any answers, but I'm going to kind of challenge you here again to spend 5 minutes after our session today and write down between 1 and 3 ideas that were new or insightful for you today. You don't need to share them with anybody, but just to jot them down for yourself, and then you'll have them for tomorrow when you start your day. So thank you, everybody. I'm going to stop sharing so Steve and I can see people or see ourselves. So have a great day, everyone. And this concludes our presentation for today. So thank you very much for attending.
Thanks very much. It was a pleasure being here.
Thank you, Steve. And I guess you're like 3 hours ahead of us, so you're coming up you're later in the evening than we are.
Yeah, it's 10:30 here. Yeah, but it's all good.
Yeah.
I'm a night owl, and as you heard at the beginning, some of my friends think I never sleep, so it's all good.
All right.